Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello and welcome back, everybody. Today we have with us Dr. Sarah Samaan, who is going to be talking to us about some of the things she's been doing in medicine and beyond medicine. Welcome. I'll let you introduce yourself.
Thank you. Thank you so much for having me on the podcast. I'm really excited to be here. I've been a huge fan of yours. So I'm Sarah Samaan. I'm a cardiologist. I retired in 2022 after nearly 30 years of practice, graduated from med school in 1988. So quite a long journey. I worked full-time until I retired. And when I retired, I was 59 years old, so just a few years ago. And I retired for a number of reasons, but really for personal reasons, wanting to pursue other passions that I really could not fit into the life of a cardiologist. So, and I'll also mention, I'm a cardiologist, but I grew up in a family of physicians. My mom was in family medicine. My sister and my brother are both in family medicine. I know a lot of your guests and audience are in that sphere, and so I have a lot of personal connection to people in family practice and really in all branches of medicine.
Yeah, wow. What took you into cardiology specifically?
So I enjoyed internal medicine a lot. In fact, when I was in medical school, I thought those were the smartest people, the people that I rotated with who were internists, they always had an answer or they knew how to find the answer. And so I was really impressed with what they did. Actually, where I went to medical school at that time, we didn't really have a lot of exposure to family medicine. I think that was still a pretty new specialty, but just the idea of taking care of the whole patient. And so um, as I went through internal medicine, I found that I really enjoyed the immediacy of cardiology, but also the long-term relationships. So it was kind of a nice combination of both the critical care aspect, but also the ability to work with people long-term and to be parts of their lives and help them recover and reclaim their own autonomy.
Yeah, yeah. So this is a long career that's only recently kind of retired, which I want to find out a bit more about later. But tell us about that transition, if relevant to you, maybe from the paper to the electronic. What was life like as a cardiologist? How much time did it consume around your day or week?
Such a good question. When I first started in private practice, I was on a university faculty for a year after I finished my fellowship, and then I transitioned into private practice. So when I first started, I was perhaps seeing 15 patients a day, which was a nice pace. I felt like I had plenty of time for people. I could call my patients. We had paper charts, but we also dictated. So I wasn't responsible for writing the notes. We had a whole room because I was part of a large practice. There was a whole room of, at that time it was all ladies who would just type all day long, and they would make our notes sound very good. So we would, dictate into this dictaphone and they would type up the notes. So it was really quite easy to see a patient in the allotted time, quickly do a dictation, check a few boxes on a sheet that we would then hand to the patient, who would take it to the checkout person, who would input any billing and place any orders, and figure out all the correct codes in order to get the test done. And so as a clinician, my job was basically to take care of the patient, and that was it. And so over time, because of the rising costs of doing business and the reduction in reimbursements over time, I ended up seeing more patients. So, eventually I was seeing maybe 20 patients a day, which would be, 15 plus minutes for a follow-up, 30 minutes for a new patient. So a new patient would count as two patients. And but there was plenty of room for either working people in or stretching out an appointment if somebody needed extra time. There was enough room in the day. And that's about the time that the EMR came in. And so that really started to change things. As I think we all know, the extra work added on to physicians' day of, filling out the chart, checking the right boxes, doing the correct billing, and then the immediacy of the messages, the expectations that were set that people would get an immediate reply. At the same time, our staffing was cut. So my nurse used to just work with me. She, her responsibilities increased to having four doctors. So her workload was stretched. And so over time, this is what happened. There was just less time for face-to-face with the patient, but more patients. And eventually it increased to 25 patients a day, which I think probably many physicians are caring for, but that really allows less time for each individual, less flexibility to work somebody in. And with the EHR requirements, that 15-minute appointment, as we know, gets truncated to maybe 8 or 10 minutes because you've got, 5 minutes to review the chart, go in, do your notes, and get the orders in, etc. So I think this is a story that probably a lot of people can relate to.
Yeah. Tell us about you said that the nurse was now responsible for four doctors. There's no more dictation to typing room of women happening, and there's a pressure to add more patients. Now I'm confused. Where is that cost going? Because you're generating increased income because you're seeing more patients, and there's less than half the staff left.
Yes.
Like, this is interesting math, isn't it?
It is very interesting math. And I think that this speaks to the fact that Medicare reimbursement and insurance, because we know that at least in the United States, and I don't know how it is in other countries, but in the United States where I am, the Medicare reimbursements have dropped and insurance kind of tracks with Medicare. So one of the statistics is that relative to 2000 or thereabouts, our reimbursement has dropped about 25% when we account for inflation. And then I think that most of us are aware that Medicare cuts are continuing, and I believe this year there's an even greater reduction in the amount of money that is paid to physicians, so that we're being asked to do more with often a sicker population because people are living longer with much more complex chronic illness. So we're being asked to do more and being paid less in less time.
Got it. Okay. So there's the either same or less dollars per patient coming in, plus you've got the increasing cost of the building, the staff, the overheads, and then we've got the aging population coming in, which increases complexity even further, plus all the advancements, like massive advancements. So there's now tests that weren't available in 1988. There's a million more medications that weren't available in 1988. Like the ability to really micromanage your patients is wonderful. and more complex within the room. Yeah.
Yes, I have to agree with that. And I think it's one of the real joys of being in practice. And as a cardiologist, the things that I could offer my patients in the last few years of practice were unheard of when I started.
Yeah.
And the recovery of people from really complex illnesses was markedly improved. And yet we had more elderly or complex patients requiring ever more complex care. And it's a wonderful thing because we can give these people back life and time, and yet these types of situations do require more time, more energy, more effort, more keeping up on the part of a physician.
Yeah, yeah. Tell us about that work-life balance, or however you want to describe it, that happened around that transitioning into EMR, increasing the number of patients you're seeing a day. Now you're having to manage the charting in the room, or after the event. What happened to your ability to contain it to the day?
Yes, and that's a great question. And for me, I've always tried hard to keep work at work and home at home. That's not always possible. For example, when you're on call, that's not always possible. And sometimes when you're on vacation, which we can talk about, sometimes it's just easier to try to keep up than being faced with a barrage of things when you get home. So what I did was I ended up spending more time at work, just getting things done before I went home. Different people in my practice dealt with that in different ways. A lot of people would work late at night, if they had family or other obligations to take care of, they might put the kids to bed and then do their charts. I preferred to stay late and get it all done, but it did add easily an extra hour plus on the end of the day, if not longer.
Hmm. Got it.
Yes.
Yeah. Tell us about the other roles and responsibilities that you had picked up as well.
So at work, there were definitely other responsibilities that I had. I was co-director of an echocardiography lab, which was a very busy laboratory, and my partners all contributed. So it was something that was expected of all of us to work hard and turn over these studies, get them read, and get them out in a timely way. But this also kind of continued to increase in volume because, again, we're trying to be more productive so that we can keep up with the cost of doing business and uh, keep our paychecks at the same level. But to do that required at least 30% plus more work by the time I left than it did at the beginning of my practice.
Yeah. Was that director position specifically paid for that role, or that was part of the cooperativeness of you guys as a group?
It was not paid. And that was one of the things that I think a lot of physicians um, struggle with or just accept as part of being a physician. We have a hard time saying no. And we're not conditioned necessarily to ask for more. And to be honest, when I did ask for more, I was told no, but I was also encouraged by the staff to continue to do that. And I felt that personal obligation to the people that I worked with to continue to do that.
Yeah. If it was difficult in that it took up time and you're not getting paid specifically for it, you're having that positive feedback from your staff to please keep doing this. How long before you kind of pull that no thank you out?
Yes. Well, for that particular position, I continued to do that really until the end. At first, at one point I said no, and then the staff that I worked with was uh, kind of asking me to continue, and because I felt like I was part of that team, I decided to continue to do so. Earlier in my professional life, I also took on some other responsibilities. One point, I was chief of medicine at one of my local hospitals, and another point, I was chief of cardiology. And those were positions that I was honored to have that opportunity. And for me, what I found was that it required a lot of extra time, meetings in the evenings, other meetings that would be scattered throughout the month. And that didn't translate into a real benefit for me beyond being able to have that title. Now, I think that for some people, that's a stepping stone to something else that they would like to be part of. And for me, that wasn't something I aspired to. Being in an administrative role wasn't really something that excited me. So for me personally, I learned that at a certain point, I just had to say no, that that part of my professional life was behind me.
Yeah, got it. Okay, got it. I think that's important for listeners to hear is what it takes to, well, one, you're going to get offers of promotion or positions, and then what it will take to do that position, how long it's going to take, and whether it's something that is helping you towards your career or something you're really passionate about, or something that you start to in that decision making, do I want to keep this? Is this something I want to do? And so hearing that from you is really helpful, I think. So that's good. Yeah. Yeah. Tell us about the lead up to retirement and the things you've done since.
Yes. So I decided probably around 2019 that I needed to start looking into retirement because there were other things I really wanted to do. And I wasn't really sure how that was going to go, what it was going to look like. But I knew that I didn't want to continue at the pace that I was going with with the situation that I was in, with the kind of the overwhelm from the EHR. It was something I was keeping up with. I had a pretty good system for getting it done, but it just felt oppressive. And I just got to the point that I really didn't enjoy going to work, even though I loved my patients. I really liked the people that I worked with, loved the staff that I worked with. So I had a very good setup, and I worked in a hospital I was really proud of, but I knew that for my own well-being and because there were these other things I wanted to do, I had to eventually break out of that. And I did look into, what would it take to work part-time, but what I realized, and I think this was kind of a really important revelation, was that even if I went part-time, the work wasn't going to go away. The EHR, which was giving me the most angst, was not going to go away. In fact, it probably would get worse because it's not like my patients would necessarily have gone to somebody else. They still would be my patients, and I would be responsible for the EHR, the messages, the studies, the follow-up. So, and yet at that level, I would have been paid less than half, probably closer to like 35% of what I would be making otherwise, because I wouldn't be taking call either. And so I just realized that that wasn't really sustainable for me and that it wasn't worth it to me. I'll say that from about my early 30s on, I was being careful about putting money away so that I would be in a position to be able to do this. And that's something I'm really grateful to my younger self for. So when I decided this, I really spent a lot of time, I guess you would call it journaling, just sitting down every night at the end of the day and just thinking, what do I want to do? What really matters to me? And how am I going to figure this out? And as I kind of went through this process, I realized that I have horses, and that means a lot to me, and I wanted to be able to spend more time with them. But I also, when I was younger, I was very much involved with the arts. I'm a photographer. It was something I really had not been able to devote a meaningful amount of time to. And I really wanted to be part of that community, not just be on the outside. And that really felt meaningful to me. And so I just couldn't figure out how this was going to look. And I didn't want to talk to any of my partners at work because I didn't want them to know this. And I wasn't sure how people were going to take it. And I didn't really feel like there was anyone that I could confide in. And so that's when I found a coach. And so I was really fortunate. I found a coach that I felt very connected to. And at about this time, the pandemic hit. So I made my decision, but then the pandemic hit. And so it was actually a good time to be able to talk with the coach and really kind of work through what my values were. So going through that values exercise, I think was really valuable, so to speak, because
Mhm.
I developed a lot more self-awareness around that and kind of learned a little bit more about myself and who I am and why those values were meaningful to me. And so, I just worked through the pandemic. There wasn't really any reason not to at that point. And it was actually, as a cardiologist, it actually felt like a good kind of team building situation. As horrible as it was, as many patients as we lost, it felt good to be part of something that was trying to make things better for people. So I'm glad I had that opportunity, as much as I would never want to go through that again.
Mm.
So by the time that I retired, I knew exactly what I wanted to do. And that was really, well, I knew what I wanted to do, but then I've had a lot of surprises since then, but I knew the direction that I wanted to go.
Yeah, yeah. And you've returned to studies. Tell us about that.
Yes. So one of the things that I wanted to do, as I mentioned, was to get more involved in the arts. And I was really interested in obtaining a master's degree, a master's in fine arts, partly just because I wanted to be, again, part of that community as well and not just an outsider. But when I started looking into that, what I realized was I had been so disconnected from that world for so long. And I had some college classes that might have applied, but I knew if I tried to apply, I didn't have a portfolio to show for myself. It would just be ridiculous. And so I actually started out by applying and getting accepted into a bachelor's of fine arts degree program, which I've completed actually last year. And then I started the master's degree program. So it was a lot of fun.
That's good to hear. It's good to hear fun as part of the experience after such a long and often difficult career, by the sounds of it, to do go back and say, what was that thing I was interested in way back when?
Yes.
And
Yeah.
spending some time there. All right, what else have you been up to?
Yeah. So I'm also a registered yoga teacher. That was one thing in the pandemic that was great. I've been practicing yoga for 25 years, and I always wanted to be and go through yoga teacher training, but I never had the time to set aside for it. And so one of the benefits of the pandemic was a lot of things went virtual, and I was able to find a yoga teacher training course that was actually based in the UK that I could do virtually. And so I did that and got qualified as a yoga teacher. And it was really more for just the enjoyment of it and learning and I've taught a little bit, but it's not something I've done a lot of. It's not something that really I have a lot of interest in doing long term, but as a yoga teacher, then I was given the opportunity to take a mindfulness coaching program, which was also really interesting. And I realized this is something that could be applicable to physicians, but what I learned in that program was not nearly enough to be able to work with doctors.
Mhm.
And so then I found the Physicians Coaching Institute, which is based here in the US, and I did a 6-month intensive program, which I loved, and then started my own coaching practice at that point. So that's one thing I've been doing. And then, kind of at the same time, I started thinking about how art and the humanities can really help physicians to connect to patients. And that was something I started thinking more about during my bachelor's degree program. I wrote a paper about it. My professor introduced me to an artist who was working with medical students. And then I realized there's this whole community of medical people, physicians, nurses, other people in the medical profession working with museum educators to develop courses for medical schools and nursing schools and medical teams outside of the educational realm to use the experience of art to help foster communication, comfort with ambiguity, cultural competence, all kinds of things that art can help to connect people in medicine to. And so I'm almost finished with the course that I've done with that, and I'm involved with my local medical school here in resurrecting a course that they have that involves museums. So it's
Wow.
been a great journey.
Yeah, that's so fascinating. Tell us about cultural awareness and art. How does that fit together? What
Oh,
would you,
yeah,
yeah.
such a good question. So one thing that I think really helped me as a physician, and I realize this in retrospect, was my experience with art. Because I think when you are somebody who engages with art, not necessarily an artist, but just somebody who engages with art, you are seeing the world through somebody else's eyes. And so art is the manifestation of somebody else's vision. And so when you can actually spend time with a work that somebody's created, you see the world the way that they're seeing, or you are able to sort of connect in some way to start to understand what they might be seeing or what they might be experiencing and what that community that they come from might be experiencing. And so that's something that has been recognized. I don't know that it's been studied, but it's been recognized as a way to foster discussions amongst groups of people. When groups of people, either healthcare practitioners or others, can all engage with a work of art together and start asking questions, it can really foster discussions, understandings, and also sometimes give us an idea of maybe what our own unconscious biases might be, or our assumptions about people. I don't know that bias is always the right word, but the things that we might assume about somebody, we might learn something different
Mhm.
about when we engage with a work of art.
Lovely. Very good. Yeah. What about within the coaching practice? What have you been surprised by, or who do you work with? What sort of topics, themes come up for you within your practice?
Yes, that's a really good question. So I assumed when I started coaching that I would mostly be working with people that were perhaps transitioning out of practice or were mid-career dealing with burnout. I didn't expect to see so many newer physicians fighting burnout. And that's been a real eye-opener. And it really something that is really meaningful to me, because these are the people that are our future,
Mhm.
and we've got to support people that are early in practice. So seeing the amount of burnout and dissatisfaction and just stress that younger physicians are under, dealing with things that I never had to deal with in my early career, has been really eye-opening. And when I say that, dealing with things I never had to deal with, dealing with, for example, Press Ganey scores,
Mhm.
patients saying horrible things about them on social media, um, dealing with maybe staff issues that we never had to deal with, when we owned our own practices. When you're an employee and a staff member is an employee, then it sets up a different balance. And many times it's works out great, but there's so many times where physicians just are not either trained in dealing with these interpersonal issues, or they just are uh, kind of shocked that it's not something that they expected as they present themselves as a physician to be dealing with these really uncomfortable encounters with other people on the medical team.
Got it. Yeah. How does the coach help with that early burnout and that dissatisfaction in medicine? What are kind of the skills or ideas that can be useful to them?
Yes. So when we talk about burnout, it's important that people realize that it doesn't mean there's something wrong with them. You know, burnout is not your fault, and yet it is something that needs to be dealt with. And so the answer is not always leaving. That's usually not the best answer. You know, you've devoted all of your young adult life usually to becoming a physician, and it's a really worthy profession. So dealing with burnout is kind of a multifaceted process. First of all, we often will start with identifying, you know, what are the values that brought you into medicine? What really matters to you most about being a physician? Are there ways that you can access those values within your practice and use that to perhaps change the way you practice? Maybe the practice you're in isn't the right one, or maybe there's ways to make it work, but understanding what matters the most to you, and then setting boundaries. So as I mentioned, when I took on some extra roles, for me, those roles were not something that I found to be satisfying or meaningful after a period of time. For other people, that might be the right thing. But there's often places where you can look at what you're doing and say, you know, what can I say no to? What am I doing that I don't need to be doing? What have I taken on? Am I on this committee and I really don't want to be, but I felt like I had to be? You know, can you say no to that? And so looking at that, looking at autonomy, is there a way within your practice that you can have more control over your schedule, for example? Perhaps there's somebody you can talk to. I've often had situations where physicians are able to find a different role within their organization. You know, maybe it's in a different location, or maybe they have an opportunity to teach within the institution that is more uplifting for them. So finding something that really fits with what matters to them. And then also looking at their personal life and what are the things that are weighing them down at home, and are there ways to mitigate that? Like, can you get somebody to do the housekeeping, or can you pay somebody to walk your dog during the day so you're not stressed about going home to walk the dog? Can you get a babysitter once a week so you can go out on a date night? These small things that can add up to a lot greater life satisfaction.
Yeah, love it. Okay, difficult question maybe. I don't know. If you were to look back on your career and you kind of, it sounds like you put off this joy of fine art for a lot of the career, and then you picked it up at the end. Do you see a different path that could have been interwoven, or do you think that the career was so big that it didn't leave room for the fine art, even in retrospect? What do you think?
Yes, you know, I think about this, and I think that the people that I knew when I was an undergraduate in college would probably say, what took you so long to, you know, get out and go on to this other part of life? But honestly, I loved being a cardiologist, and I loved taking care of patients it was really, really meaningful. And to be part of people's lives was a real privilege. To get to be part of all of the changes in healthcare, the things that made people's lives better. That was really exciting. And so I don't regret being a cardiologist. I think it would have been really hard to be part-time. I don't think that would have worked. Um, there's only so much time in the day, and I did have other things. I have horses, like I mentioned, and so spending time with them was has always been important. And so I don't really see a way that I could have made this different, but I did always stay involved in my community, at least, with the museum, spending time there. And if there had been more time in the day, then yes, I would have loved that, but I don't think there was.
No, it sounds like your passion was there, like you were involved and you were involved in a level that worked within your career until you had time to actually immerse yourself back into it, which is different than I put it off completely until the end. And I think that's,
Yes.
yeah, yeah.
Yeah, and I think that's something really important for people to keep in mind. If you do have a passion, at least keep a toe in the water, even if it's not much. If you can just keep something connected, it's going to make it a lot easier down the road if you have more time, or it may open up opportunities for you that you might not realize that will allow you to use the limited time you have in a way that matters to you.
Yeah, absolutely. We want you to make sure you have some joy, some love, some rest, some downtime all through your career, even in those really busy periods, just keeping a toe in the water, like you say, really helpful towards that uh, preservation of you within medicine.
Yes.
Yeah,
Yes.
absolutely. Any parting words, anything we didn't talk about that you'd like to talk about before we finish up?
Well, the one thing I will mention, I mentioned that I have horses, and when I was early in my practice, we automatically got a half day off. That was just assumed. And as as reimbursements went down and we were having to see more people to make the same amount of money, I did make that decision that I would keep my half day off. And it did cost me money. It actually cost me a lot of money, because of the way our practice was structured. Taking a half day off a week was a pretty big chunk. But for me, that was so worth it. And I wouldn't have been able to really have them otherwise. And for other people, doesn't have to be horses, maybe some other passion that you have, or just time with your family that you can't ever get back. And so for me, being able to say no to that part of my financial compensation and just say no, I don't need it. If I never see it, it's not like I lost it. It just isn't there. And continue to do something that I really that really kept me going and made me happy and gave me a group of friends outside of medicine. That was really important. So I do think that for people that are thinking about, is there a way to balance out work and life? It may not be possible to do every single thing every single day. And you might have to carve that time out and just take the financial hit that entails. But that's really going to be something that opens up other opportunities for you if that's something that you desire.
I love that. It very much sounds like that sustainability piece right there.
Yes.
I'm going to take that hit to my income because I need it for my sanity, for my friendship, for my exercise, for my love and passion. Love it. How do people find you if they're looking to connect?
Yeah, so you can find me at my website. It's mindfulphysiciancoaching.com. I do have a free values workbook. If anybody wants to sign up for that, you can just put in your email and you'll get the workbook. There's absolutely no obligation whatsoever, but I'm happy to share that with anybody who might find that useful.
Love it. Well, thank you so much for being here with us and helping us just kind of understand the journey from a different perspective. We're finished, done, and we're moved into your new passion project. I love that for you. And interested to see what you'll be doing with physicians, medical students, and our colleagues in the future.
Oh, thank you so much. I really enjoyed our conversation today.
Yeah, have a great day, everyone. See you. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.